how long can I take an antibiotic for my acne? That's the question that we're going to talk about today. When we use antibiotics to treat acne, we like to limit the exposure to the least amount as possible. There are certain things that we like to avoid, for example, the development of antibiotic resistance in bacteria and other long-term potential effects that we try to avoid. So the general feeling is that we like to limit our exposure to antibiotics for a few months, and we try not to go longer than that if we can help it. Sometimes we can reduce the dose of the antibiotic and maybe use a very low dose of an antibiotic for a much longer time safely. For example, some antibiotics are used in a very low dose because the effects that we're looking for are anti-inflammatory and not really looking to kill bacteria. So in that scenario, we can use antibiotics for a very long time, but the dose is so low that it's not functioning as an antibiotic, so we don't run into the problems of bacterial resistance and other problems. In other cases, however, we like to use an antibiotic for a strategic period of time, achieve the results that it can provide, and then transition into something else like a topical medication regimen. So the bottom line is, if we do use an antibiotic, use it for the shortest period of time, usually not to exceed a few months, achieve the effects that we're looking for, and then reduce the exposure and move on to topical medications for maintenance.